the ASGCT Communications Committee, and we are live here at ASGCT 2026 annual meeting in Boston. You are listening to the Soundbites of the annual meeting podcast, and today I'm here with Dr. Claire Booth, Professor of Pediatric Immunology and Gene Therapy at UCL Great Ormond Street Institute of Child Health. She leads a stem cell gene therapy program and oversees clinical trials across immune deficiencies, hematological disorders, and metabolic diseases. Welcome, Dr. Booth.
Thank you. Thank you very much for having me.
Your keynote touched on new pathways from breakthrough science to rare disease therapeutics. What's the one idea you hope people take away?
I guess hopefully what this conference has also shown is that there's not one size fits all approach to this, particularly in the ultra rare space. So I think even in that session we heard Terry Pirovalakis talking about the amazing results that can be achieved with patient-driven research in a very short time and for a very reasonable amount of money. I think we've also heard talks about public-private partnerships and also the academic development, which I talked about. So I guess what I want people to take away is that just explore all of the different options depending on your disease, where you're working. It may just be a different approach that's going to suit you, but we have to try these things, and hopefully one of them will work and show the way forwards, and then it'll open the door for other rare disease therapies to come through.
That's a great point. It's a really important perspective. And we're just wondering what's changed recently that makes this moment particularly different from a year or two ago.
I think the fact that we're talking about it. There's still a load of great science at ASGCT, don't get me wrong. But if you think 3 or 4 years ago, the focus on regulatory was just not really there. Certainly not the focus on getting therapies to patients. I think we were still in that phase of a lot of industry involvement and trials and we weren't seeing so many approved therapies coming through. And now that we are, I think we're recognizing some of the more significant challenges. And I think ASGCT over the past certainly 2 years or so has really embraced that and supported it. And so, quite a lot of the talks that I've heard at this conference already have been around, patient staff access issues. So I think that's a big change, and I think it's a really nice meeting. It feels very a little bit different and focused on actually, what we can achieve for patients.
That's great. In terms of the challenging, what do you think the field may be over-indexing or missing the mark?
I think we're doing a great job in so many areas. And I think I said in a talk I did earlier this morning that, like you say, what changed in the past 3 years? Well, 3 years ago we weren't talking so much about all the regulatory innovation and what we can do to, move these rare disease therapies forward. And now, there's a lot of talk about it. There's some progress. We're seeing some results, and hopefully some of that will come through. So I think now what we need to be focusing on is the next step, which is kind of the reimbursement step. And how do we get these therapies? So it's now we've had them licensed. Okay, how do we get them paid for and actually into the system? And so already we need to thinking about that as a kind of parallel now to all of the amazing work that's happening in the regulatory space.
That's great. It refers to, you mentioned about the insurance. And when you zoom out, what are the real-world implications of your work, especially for patients and for how these therapies reach the clinic?
Yeah. Well, the results for the patients is just extraordinary. We've seen so many talks, where we've seen children walking again or hearing again after, a single treatment. And this is fantastic. And in our field, again, we've basically cured patients with some of these blood disorders and stem cell disorders. So, we have to kind of keep that in mind. And whilst our therapies are still very expensive and, and we need to tackle, those aspects of it, I think we have to encourage a change in thinking that actually some of these therapies can be cost effective. We just have to find a different way of paying for them. Especially for example, the metabolic disorders, they can be treated with enzyme replacement therapy, some of them, but that's a treatment that is super expensive, doesn't necessarily work really well. And so, what you're spending that money on isn't getting the best patient outcome. Whereas, some of the therapies that we see the results of here, one-off, they're cured essentially. And whilst it costs a lot at the beginning, actually you've probably saved money in the end. So it's about framing that kind of health economic argument. And again, I think that's something that we need to start moving to think about more.
Yeah, it's very important perspective. So in terms of like the next generation, what would you want the next generation in this field to take from this moment? So exciting.
Oh, that we're really trying to get these things to patients. And this is one of my kind of concerns because, if we don't have an exit strategy for these therapies, then like the science is exciting and amazing, but it's not useful. So, we have to encourage the younger generation that yes, the science is amazing and these are the transformative results that we have and we can get it to patients. And I think once we can do that last part, that will hopefully stimulate people. But still, come on, we've got all these amazing technologies, all these opportunities. So don't give up. There's definitely hope and there's a lot of people working on it. And if we look at the progress that we made in the past couple of years already, I think something's going to work.
That's great. Dr. Bruce, thank you so much for sharing your insight today. It's been a really thoughtful discussion and a great compliment to your presidential symposium earlier.
Well, thank you for inviting me.
Thank you. Thank you to our audience. We will be back soon with the next episode of the Soundbite of the annual